Hello and welcome again to Afternoon Tea with Docs. I'm Linda, emergency medicine physician here from Sheffield, and I am here with a lovely guest co-host today, one of our colleagues, GP trainee, Dr. Siobhan. She is a lifestyle medicine enthusiast, and I'm so happy to host this event today with her. For the last few weeks, we have partnered with the Dandelion Seeds Foundation to bring the prestigious Complete Health Improvement Program free of charge for the residents of West Somerset and Taunton Deane area in the UK. You can now sign up on our website for the next free program, and the dates will be announced very soon. We host afternoon tea every Sunday at 5 p.m. UK time, where you can connect with world-renowned experts, and we share 3 actionable takeaways that you can implement in your life right away to start achieving your health goals. You can chat directly with our guest experts here on Zoom, or follow us on live stream or via Instagram, Facebook, and YouTube. If you're ready to implement your life goals, join our free membership on our website to be part of our supportive community to set you up for health success.
So we are focusing on metabolic diseases in May and June this year. And today we have the absolutely incredible Dr. Rajiv Bajekal to join us for afternoon tea to talk about his own experiences, both as a clinician and as a patient. Just a little bit about him. So he's a consultant orthopedic and spinal surgeon with over 35 years of clinical experience. Clinically, he's got interests in back pain, spinal problems, sciatica, and degenerative disc disease. But his real passion, which he hopes to pursue full-time after retirement, is lifestyle medicine. He grew up in South India with the amazing advantage of living with nature and through nature, and had very little dependence on kind of supplies from outside and anywhere else, and was able to very much live a plant-based diet. After graduating and completing his studies, he then came to the UK in 1991 and has worked as an orthopedic consultant, mainly in London hospitals since. He then had his very own personal experience of using lifestyle medicine to treat and reverse his own diabetes, which I will let him tell you more about. But since 2017, he has been pursuing a healthier lifestyle for himself. And then in 2018, him and his wife decided to scale up that lifestyle medical interest and make it available to their patients. And he is the first orthopedic surgeon to have acquired the lifestyle medicine diploma. As well as that, he somehow finds the time to also be their senior examiner for the Royal College of Surgeons, and he contributes to lecturing on bone health at the Winchester plant-based course, and lecturing on the Orion Developing Osteopathic TV forum to doctors and allied health professionals to raise awareness of lifestyle illnesses and how to prevent them. So after that brief introduction, which definitely cannot do him justice, welcome, Dr. Bajekal. It's so lovely and an absolute honour to be able to talk with you.
Hello and welcome.
Thank you very much. Well, what a lovely introduction, and what a pleasure to be on this platform. I mean, you guys inspire me every day, Linda with her bicycle and going all around here, there, and everywhere. But really, because of your enthusiasm and passion of spreading this message. And I see your YouTube channel from time to time, and I see you've had wonderful people on, my great inspirations from early days in lifestyle medicine, and Professor T. Colin Campbell, Dr. Clapper. Dr. Clapper has actually become a personal friend of ours. So Neetu and I both know him very well. He comes and stays with us. Sadly, we've missed him over the pandemic period, but every time he'd be in England, he'd come and stay with us. So it's, I mean, we've got to know him really well, and he's literally a fantastic inspiration to us all.
Wow. Well, you certainly have some incredible friends, Dr. Bajekal, and it's such an honor to have you here with us. You have an incredible story to share with us, both from a medical healthcare professional point of view, but also from your own life story. Where did it all start for you?
Well, if we go back, right back to my childhood, thankfully, and I think I've survived because of that. And as Siobhan said, I grew up at a boarding school in the south of India. It's called Rishi Valley School, and it was founded by a philosopher called Jiddu Krishnamurti, who's quite well known. Um, and he's written a lot of books and has a lot of followers. And he actually lived his last few years in Ojai in California. But he founded the school, which was in the middle of literally nowhere those days. So we weren't well connected. I mean, this was, almost pre-telephone times when there was one telephone in the school. And we lived in a valley with a huge banyan tree and 300 acres of land where we grew our own vegetables, and we ate that. So we ate whatever we grew, which was fantastic. I mean, we had a little dairy, so it was vegetarian rather than plant-based, but it was pretty much, as close to whole food plant-based diet as you can get. The rice we ate, and I still remember it vividly, was brown rice, which I never got to see after I left school for many, many years till more recently. And we all know brown rice is much healthier than white rice. So I grew up on that diet. And then subsequently, I did my medical school training in Pondicherry in India, and then moved on to Delhi, where I think, all those times I was much younger. And when you're younger, as Ray Cronise, who's a NASA scientist who's written quite a lot about nutrition, says, when you're young, you can eat anything and get away with it. And I probably ate a lot of garbage, but didn't really put on too much weight and didn't really have any health concerns. And of course, we all know that it takes quite a long time of exposure to a lot of bad foods and bad habits and deprivation of sleep and so on, that you start putting on weight and then getting these chronic metabolic diseases that we see. So when I moved to England after qualifying in orthopedics. So I did my MS, as it is called, in orthopedics at the All India Institute of Medical Sciences, which is the apex institute in India. And Neetu's my wife, who you've met on your program. We met in medical school days, and we had a romantic few years in medical school. And after we graduated, we got married. I moved from Pondicherry to Delhi because Delhi was the apex medical institute, and I was lucky to get the one place in orthopedics. And I thought that was, we discussed it, and we were going to have a long distance relationship. But you've met my wife, and you know what a formidable woman she is. So she was determined to catch up with me. So she did the entrance examination a year later and got into the same institute as I was in. So I think that's a far better achievement than what I had achieved. But anyway, we were together and we decided we'd get married when we were in Delhi. So after 5 years there, we got the wanderlust and decided we wanted to see the Western world. We fancied travel in the Western Hemisphere. So we moved to England. We had to do the PLAB examination, which you're probably aware of, and came here and started on the lower rungs as a senior house officer and went through my FRCS training and so on. And I think the first few years were pretty difficult. As you know, junior doctors those days, we used to have some very long hours. And in fact, we used to consider it the right way to do things was to work 110 to 120 hour week. we thought nothing much of it. And we thought, that's the way life was. We'd compromise on sleep, we'd compromise on food, we'd compromise on exercise, but we never compromised on the number of hours we spent in the hospital. So I think I used to think it was just my bad diet, but with the benefit of hindsight and a bit of knowledge about lifestyle medicine, I realized it was probably a combination of factors. So the food, the first few years that I was here in England, I was still eating some red meat, some junk food, well, a fair bit, I would say, because pizzas and burgers found their way into our diets. And really, lunch was on the run in the hospital. And the standard lunch when I was doing my medical training in the UK was a prawn salad sandwich, or, in my early days, a ham sandwich or something on white bread with a can of Coke or Lilt or some sugar-sweetened beverage and a packet of crisps. I don't know why that was such a traditional, it was almost like you were combining beans or lentils with rice. But the combination was a sandwich, a sweetened drink, and a packet of crisps. And I think that, together with the lack of sleep, lack of exercise, you put on weight gradually, or I put on weight. And before I knew it, by the time I'd spent 10 years here, I had put on 15 kilograms of weight. Fortunately, I'm quite tall, so I'm 6 feet 1 inches. So it didn't show, obviously. But my daughter turned vegan in 2002. She was age 10, my younger daughter, Naina, who is a journalist and works for Time magazine. She turned vegan. She came back home one day and told us, "You didn't tell me that sausages came from pigs." So we said, "Well, you didn't ask." And, we were naive, we were stupid. We thought people needed protein. The usual mistakes that a lot of people make. But she went on the grounds of ethical reasons, completely vegan overnight, literally. And Nitu followed suit quite quickly. I had already stopped eating any red meat or chicken since 1996, which was 5 years into my career here, but I was still eating fish and dairy. My whole family gradually changed from vegetarian first, then became vegan pretty quickly. But what happened was that I resisted those changes because I said, look, I'm an orthopedic surgeon, and I go to meetings and I sit with orthopedic surgeons. And those of you who know orthopedic surgeons, they're a pretty carnivorous bunch. And I said, look, I'll starve to death if I go out with them. At least if I eat a fish or a dairy option, I'll survive. So you make all these excuses, which with the benefit of hindsight, I should have, turned vegan before it was fashionable. But I didn't. Of course, I fought them all. I fought them on the beaches. I fought them everywhere. And I stuck to my unhealthy ways until I gradually realized from about 2010 onwards, I was by that time 28 kilograms heavier, and I realized something had to be done. So what does one do? One looks at the various dietary options that are available. And I saw the Atkins diet, the South Beach diet. I went through all of them. And the Atkins diet, as you know, is, well, another iteration of the keto diet, the modern keto diet. And I wasn't eating meat. So it was, for me, it was fish. And it was a lot of oily fish. And yeah, I'd lose a bit of weight, and I'd feel proud of myself for having lost 7-8 kilograms. And then once I went back to eating my regular food, it would pile on again. My mother was elderly, and I used to visit her about 4 or 5 times a year from here. So every time I went to India, I'd get a blood test. I'd never really had the time to do any tests or see my GP in this country. I was far too busy doing my practice. And every time I do my blood test, it was showing that my HbA1c was climbing. My fasting blood sugars were rising, my cholesterol levels were going up, triglycerides were up. So everything was heading northwards. And my weight was going up. And my parents were concerned, everybody was concerned. And every effort that I made to shed the weight by whatever diet, and people would come to me and say, you must try this diet or that diet. And it wouldn't really make much of a difference. Finally, about 5 years ago, I decided, Neetu, my wife, was very interested at that stage itself in, in nutrition, in food, and so on. And she used to look incredible throughout this period because she had turned vegan ages ago. And although at that stage we had no idea what a whole food plant-based diet meant even, we ate pretty well at home, but I would eat badly outside and my habits were still very bad. So I'd sleep very little. And I used to have this, Matthew Walker, Professor Walker, who talks about sleep, calls social jet lag. So I used to say, during the week, I really can't manage to sleep more than 4 or 5 hours a night rather. Because I'm working so hard. So, I have to come back late at night on call. There's anxiety about a spinal patient who I've operated upon, or somebody has a problem. Life was pretty busy in the fast lane. So all kinds of excuses. But as a good Indian, I would nap in the afternoon on a Saturday for 4 hours. And I thought I'd made up my social jet lag sleep. But what really was important is, I think the time came when I was 30 kilograms over my university weight, which was, so I was 110 kilograms. And at that stage, I knew there was something terribly wrong. So Neetu and I sat down and we were very inspired by a book called The 8-Week Fast Diet. I think Michael Mosley had written it, and he's a friend of Walter Longo, and had written this 8-week diabetic reversal plan. And I said, well, I ought to try that, and 8 weeks of eating 800 calories a day is pretty brutal. I used to feel so hungry that at night I'd probably eat my pillow half the time. It was, but I was determined to lose weight, and I was doing high intensity exercise. I was doing everything to shed my weight. And yes, on that dietary plan, in 3 months or so, I had shed 15 kilograms. So I was down to about 93 kilograms. And then a friend of mine, an orthopedic surgeon in my department, decided that for his 50th birthday, he was, instead of throwing a party, he was going to get fitter, and he was going to get us all fitter. So I joined the cycling club and we decided we'd cycle 2 or 3 times a week, quite often 20, 30 miles. And we went on to Brighton one weekend and stayed overnight there. And, it was an adventure to do all this cycling. And I shed another 5 kilograms. So I was down to 88. But when I checked my diabetic markers, they were still going northwards, which I was surprised by. At this stage, I'd made no dietary changes. So, it was alarming that I was still getting worse with regard to my diabetes. And at this stage, Neetu was getting genuinely concerned and said, don't you think it's time we think about starting you on metformin? And I said, I really hate tablets. I've never really taken tablets for anything, not even a headache. And I didn't want to go down this rabbit hole of being on metformin or some other drug for the rest of my life. So even at that stage, I had no idea what was around the corner. But in December, I was driving with Neetu to a Christmas party at a friend's place. And I had realized that for a month or two before that, my vision was, I just couldn't see so well at night. I sometimes would miss seeing a parked car on the side of the road till I was fairly close. And I thought nothing much of it. I just thought the government wasn't spending enough money on lighting the streets. So you can imagine how poorly I knew my body at that stage. But what really was alarming was I was heading towards a lamppost at about 30 miles an hour, heading towards my friend's house when my wife had fallen asleep next to me. And she woke up with a jolt and said, "Why are you doing that? Stop." So I braked and I'd nearly hit the lamppost. So I somehow composed myself and drove on to my friend's house. And at the dinner party, there was an ex-ophthalmologist who actually has gone into software developing now, but he still remembered a bit of his ophthalmology. So he flashed a torchlight into my eye and he said, "You've got dense cataracts, both eyes." I said, "Don't be ridiculous. I'm hardly 55. What are you talking about? That's for old people." So he said, "No, seriously, you've got a cataract. You better get an optometrist, check you out." So the following Monday, I promptly made an appointment with the opticians. And Neetu said, "Do you want me to come along?" And it's a sign of how vulnerable I was that I said, yes, I do actually want my wife with me when I go to this optician. And luckily I took her along because the optician did some tests and she said, "How did you get here?" So I said, "Well, I drove down. It's a bit of a distance from home, so I drove down." So she said, "Well, you can't drive back." I said, "Well, why not?" She said, "You've got dense cataracts. You're illegal to drive." So that was the first shock I had, that diabetes had done this to me. And I had a horrible, painful, frozen shoulder. So I was getting these effects of diabetes at the time. And I knew something had to be done, but I had no idea what, no idea about any solution for this. So I got my cataracts done.
With regards to diabetes, we never speak enough about what are the side effects of diabetes. So it's wonderful that you highlighted that you had vision problems and also frozen shoulder. Could you tell us a little bit more about what is frozen shoulder and how does it feel?
Well, a frozen shoulder is one which, people get confused about what a frozen shoulder is and what tendinitis or impingement pathology is. So they're two different conditions. And the third, which is very like a frozen shoulder, is arthritis of the shoulder, which is also quite commonly seen. So the real differential diagnosis, if you like, the two conditions are a frozen shoulder and arthritis of the shoulder. So a frozen shoulder just means that you have a painful restriction of all movements of the shoulder. So you literally can't get your arm up, you can't rotate your arm, so you can't externally or internally rotate your arm. For women, the first thing that they say is they do their bra up in front and then spin it around. So it's for men, they just can't scratch their backs, and even toileting, for instance, to wipe your bottom is impossible because your arm doesn't go around. So you have to use the other hand or arm. Diabetes, unfortunately, quite often affects both your shoulders. So if you have that is almost certainly a diabetic condition that has caused it. The other thing is, of course, diabetes affects every system, as you all know. And it is, the commonest cause of death in diabetes is due to accelerated atherosclerosis. So it's, in fact, cardiac disorders that lead to death in diabetes. So my cholesterol levels were also climbing at the same time. But really, I had these two major effects. And the lady who did my optician tests said that she could look at my retina, and thankfully, there was no retinal artery problems or vision, because it's sometimes difficult through a cataract to look at the back of the eye. And it does affect your microvascular circulation. So it affects your eyes, it affects your kidneys, it causes peripheral vascular disease. So every system is affected. But the main thing to remember is that it affects the vascular system. So it affects every organ through that pattern. And a lot of people call it type 3 diabetes if it's a prelude to Alzheimer's disease. So it was not something, people in this country and almost anywhere in the world who get diabetes are often, they think, well, that's par for course. I'm old now, I've got a bad gene from my parents, so, it runs in the family, and I have to live with this and somehow deal with it myself. But we all know that, yes, okay, there is a strong genetic influence in diabetes, and by virtue of being Indian, or by the handicap of being Indian, I would say, in my case, you're very prone to diabetes. I mean, I don't know if you all are aware of the masala study, which is a pretty inspirational study by scientists in California, it's a lovely acronym, but it's Mediators of Atherosclerosis in Southeast Asians Living in America. So that's why it's the masala study. But it shows that Indians are particularly prone to diabetes, and it's a shocking statistic that BMI in general, you're considered to be healthy if you're between 18.5 and 23.5, I think is the number that's widely talked about in the West. But Indians are more prone to all these disorders if your BMI is higher than 19, in fact. You gradually, you get an incremental risk of getting all these chronic disorders. So
that could I just share your photo, and if you can share how old were you to show what an incredible change you have made here.
Okay, that's, yeah.
Yeah,
I mean, when I was asked to do a little write-up about my story, so to speak, I went through my iPhone, and there were very few photographs of me in this shape and size, because I used to be shy of being photographed. When you're overweight, you really don't want to be in a photograph. I mean, this is one of the few where I'd probably relaxed a little bit. This was in Rio de Janeiro, actually, and it was in 2012, I believe, or 2014, somewhere around that time. So I was 108 kilograms at that point, and the photograph on the right outside one of my favorite vegan restaurants in London, Pharmacy, was taken shortly after we went on this holistic holiday cruise. And this was the first year that I turned wholly plant-based and vegan. And I had shed, at that stage, I'd managed to lose 26 kilograms. So I was down to 82 at that point. So yeah, that's quite a transformational journey. And most of the change occurred after I turned whole food plant-based.
And how old were you here, Dr. Bajekal?
So I was 42 at that point.
Mm-hmm. And how old were you here after?
Sorry, just a second. I got that wrong. No, I was 52 at that point. Mm-hmm. And I was 57 in the other photograph. Yeah.
So it's completely wrong to believe that after your 50s, you cannot change how you feel and look and shed your weight. Is that correct?
Well, I feel better, fitter, and more full of energy at the age of, well, I'm nearly 60 now, than I was ever, I think, after the age of 35, and never felt as good as I've done in the past 2 years. So it's a myth to say it's too late to start making changes. you can make a change at any stage.
I love that. It's so inspiring for all of us, and that's it's not age. And with age, it doesn't mean that we have to gain weight, that we have to develop chronic diseases. It's our lifestyle that changes through these years, through our society's requirements of us, through having to pay the mortgage, the bills, the stress around it. So it's more related to our lifestyle and our economical requirements than it is with our age, isn't it?
Absolutely true. And, you know, we think we're invincible, and some of us require a medical event to make changes. And I just wish we could make changes much earlier in life to avoid the pain of what I've had to go through. I mean, a frozen shoulder is a real menace, and Siobhan's probably seen a lot in your practice, but it often takes up to 18 months to change the pattern of your frozen shoulder. So you go through this phase where it's exceedingly painful, and then you get just a frozen bit where it's not so painful, but it's extremely stiff. And then it thaws out gradually and improves. And very little in the way of treatment makes a difference to it, other than, I think, if you change your glycemic markers. So if you change and it's often associated with diabetes. So if it is associated with diabetes and you make lifestyle changes incrementally, then you make a change in your frozen shoulders also.
And that's really interesting that you mentioned it takes a medical condition, sadly. It takes a diagnosis to make that change. And now that you've been through that and made this incredible change to your lifestyle, do you have any thoughts on for doctors or for patients on how we can encourage people to make those changes before the medical events happen?
Absolutely. No, so I probably excluded the part where once I had my cataract surgery and I was still struggling with my weight and my diabetes, but I had these lovely pairs of eyes back where I could actually see a television screen, and I didn't think that the government was cutting down on street lighting expenses. So I was sitting home one day, and my wife she was working late, and I was flicking through Netflix as a bored somebody who's recovering from an eye operation does, and suddenly I was seeing colors, and it was a wonderful new world again. And I found this documentary called Forks Over Knives on television. So I started watching it, and it really resonated with everything that I'd been looking for. When it's almost as if you're hunting for an answer. Yes, I had shed, by that, at that stage, I had already decreased my weight by 20 kilograms, so 3 stone approximately. I was looking better. I was feeling better because I'd had my cataracts done, but my diabetic markers were still pretty bad. And then I saw Forks Over Knives, and unfortunately, it's just gone off Netflix, I think, and it's gone to Amazon Prime, I guess, or somewhere else. It's still viewable, but it's a bit difficult to see. But I saw that movie, and you've got my favorite 2 American nutritionists. Well, you've interviewed both of them, I think, Professor T. Colin Campbell and Calvin Esselstyn, and they partner in this movie synergistically. And, they came into this thing of, Prof. Campbell, as you know, went to Philippines to tell people that they really required to eat animal protein, because he grew up in a dairy farm in Wisconsin, I think it was. And we've met him, and we've met him on this cruise that I was talking about, and we've learned so much from him. But he's a fantastic scientist who is so credible because he's done the work himself. And he's not come into it from an animal rights angle or any other angle. He's come into it from a scientific angle, as has Dr. Esselstyn, who was actually a general surgeon, I think. I think he was a breast surgeon or maybe a general surgeon, but he got interested in this and used it on a lot of patients of his who were rejected by cardiothoracic surgeons because they were too far gone to have a coronary artery bypass graft. So, he took on these patients, put them on a whole food plant-based diet. And that movie is all about the journey of several people who go on to a whole food plant-based diet and reverse these awful medical conditions. They get off their pills, they're diabetic, they lose a lot of weight, they are hypertensive, and they go off their medication and they do incredibly well. And I watched that, and by that time, Neetu came back. My wife came back from her on call, and I said, I'm going plant-based from tomorrow. So she looked at me. I mean, she'd been trying for 15 years. As I told you, she can't sell a used car to anybody, I think, because she couldn't sell me this diet on the health basis. But so she said, have I upset you in any way? Why would you want to go off eating fish and dairy and stuff? So I said, well, I watched this documentary. So she said, for 15 years, I've been trying to tell you, and you watch a documentary and you want to go plant-based. So that was my first foray into plant-based. And I went whole hog into it because I said, there's not a bit of any more processed food that I'm going to eat. There's nothing that comes from fish or dairy or anything else. I was reasonably fond of cheese. It's not as if I was overdoing it from any angle, but none of that stuff was clearly agreeing with me. And within 2 months of a whole food plant-based diet, I lost an additional 8 kilograms. So I was down ultimately by close to 4.5, 5 stone nearly. And I'd reversed my diabetes by that time. And I've been doing my markers regularly since, and I've maintained that. So although the term reversal is frowned upon, because reversal means that you've kicked it and you can do whatever you want. Diabetes is such a condition that once you've had it, or you've caused enough damage to your pancreas that you can't go back to your old ways of eating. So not that I ever want to eat any animal-based products again, but nor do I particularly want to eat oily foods or processed foods of any kind, whether they're plant-based or not. And I have to be quite careful. I'm cognizant of that. Every time I put on a few kilograms, I know that my markers would have changed, and I have tested it. I've used the continuous glucose monitor, just to check which foods agree with me. And I'm very happy with what I eat. And I think anybody who switches to a whole food plant-based diet knows that there's very little you actually miss in fact, you add so much diversity and other ethnic cuisines to your repertoire of eating. And it's so delicious and colorful that you would never want to go back into your old ways of eating. And the enjoyment that you get of the vibrancy of good health is something that, for me, it was a domino effect, so it snowballed into everything. So everything kind of fell into place. So my sleep improved, my energy improved. So I used to tell my wife, she was keen on exercise always. And I used to wonder why, why would anybody want to do any form of exercise when you can relax and, have a glass of wine instead or whatever. But she used to say, I used to tell her, I'm just a sensitive lover boy. I'm not into exercise. But now I have so much energy that I'm bouncing off the walls. And, I walk my dogs who get tired of me walking them because we often go out for a 5-6 mile walk. I mean, I, move very briskly on that walk, and then I come back and do other exercises. So I'm often doing resistance exercises. And it's still not because I love exercise, but I don't know what to do with myself at times because I've got energy to do all this stuff.
Oh my
So
God, it's amazing. It's just so good to hear how energetic you are. And you can hear that in your voice as well, which is so beautiful to hear and feel. And Dr. Bajekal, how old were you when they diagnosed you with pre-diabetes? How long was this whole journey from pre-diabetes till you discovered a whole food plant-based diet?
oh, it was a good 10 years, I would say, before I was diabetic. So I was pre-diabetic for 10 years. I was remember, Linda, I'm not as bright as you people are. So I'm an orthopedic surgeon. So I didn't even really understand what pre-diabetes meant, So I just knew it didn't look right. I used to get these blood tests back with something highlighted in red, and I knew that didn't look good, So I knew it was pre-diabetic a few years later. But it's amazing how ignorant doctors are. I mean, as an orthopedic surgeon, I was pretty good at what I did and spinal surgery, but I was pretty dreadful at general medical stuff, which I used to just think, well, yeah, somebody else should deal with this kind of stuff. But
It's not so much just you, Dr. Bajekal, it's just the system, how we are required to specialize to make sure that medical legally we are covering all the grounds. And certainly all the doctors start out to be generalists, but the current medical legal system and how it is all set up, we unfortunately are not holistically treating the patient. And I started to see more and more doctors who are craving that feeling to actually see the patient as a whole. And I think now that you have seen the incredible results that you have achieved and that you are doing also in your orthopedic practice now, you also are going into lifestyle medicine to see these incredible changes, isn't it?
absolutely, yeah. So yeah, I mean, after I reversed my diabetes, Neetu and I used to sit down and talk about our journeys. And, we both used to, and I remember, Linda, you posted something about talking to patients in A&E about their lifestyle and there being a backlash from other doctors saying, why are you talking about eating healthy? That's got nothing to do with what we get. And that is still the common perception, isn't it, amongst doctors? And if you
Unfortunately.
go back historically, that's the way we were trained. You were trained to believe that what you put into your body by way of your mouth didn't really matter, and you.
Dr. Bajekal, on that note, how do you work the lifestyle medicine that's helped you so much into your consultations with the common orthopedic?
Yeah, absolutely. So I was worried, like Linda was, when she raised this question on Facebook, and I think that's the first time we made contact and became friends after that. So, at that stage, we were conscious that we were doling out this advice to patients about nutrition. But did we have any letters after our name to say we were qualified? Does being a doctor, is that good enough? I mean, you have to realize that the dietary world is full of these silos, isn't it? I mean, the keto world, the vegan world, or the whole food plant-based world, and real strong belief systems that clash against each other quite often. And you didn't want to fall foul of what your colleagues would say if you were doling out advice on something that maybe you weren't fully qualified for. So Neetu and I discussed it, and we said in 2018, early in 2018, actually it was on the cruise. So we've been on this cruise, which I would recommend to anybody who wants to learn about whole food plant-based nutrition. It's called the Holistic Holiday at Sea. Holistic Holiday at Sea, where we met Dr. Clapper, Dr. Campbell, and all these incredible people, Michael Greger, Dr. Barnard, Neil Barnard. So these are people we would have dinner with on that cruise. And, it was an incredible experience. But really on that cruise, Dr. Gregor told us, well, why wouldn't you want to do this lifestyle medicine qualification? In fact, Britain is going to offer it very soon, and you can get information from the British School of Lifestyle Medicine. So we did. And in 2018, we took the diploma in lifestyle medicine. It's an International Board of Lifestyle Medicine course. And uh, at the age of 56, which is what I was at that stage, studying a completely new um, area of medicine, about stuff like exercise, stopping smoking, alcohol, exercise, all these kind of things was so new to me. And as I said to you, the orthopedic surgeons don't consider themselves very bright at all. And there I was studying all these fantastic things, and I had a passion for it. So both of us studied together, and we qualified in 2018 with the diploma. And so that gave us those extra letters to be able to advise patients and scale it up. I mean, there's no point having this knowledge. I mean, knowledge is of no use unless you impart it and share it with others.
And
So
do you
how
feel
do I do it? Yeah.
yeah, you feel you're able to do that in your daily practice?
Yeah, so it's as we were chatting before, Siobhan. So GPs have 10 minutes to do it. We have a little more of luxury of 20 minutes. Um, Fortunately, at my level of seniority, I actually don't take too much time to get to the crux of the back problem. So if somebody comes and talks to me that I've got sciatica going down this leg in this area and I've got numbness in this toe, I just know which disc it is. I've been doing it for so long that I tell them you've got a bulging disc or a prolapse disc at this level. And that takes me 1.5 minutes. So the patient is shocked by then, but I then switch to, all right, I'll sort that out. So we'll get a scan done or whatever it is that you need doing. But let's talk about your diabetes and your other chronic conditions that you have. And I want to offer you some help with regard to that. And they're quite amazed. They're coming to a surgeon and hearing stuff about diabetes or weight loss or, some other chronic disorder. And sometimes I am pushed for time because patients want to know a lot more about their back pain, in which case I managed to slip in the 3 documentaries that have inspired me. One is Forks Over Knives, as I said. The second is What the Health. And the third is The Game Changers. And I'm sure you've seen them all. I mean, they're in the repertoire of every plant-based doctor, I would say. But
Yeah,
I tell my patients, would you please watch these 3 movies? And there's nothing as impactful, I think, of a visual effect of seeing people actually making these dramatic changes in their lives with a simple discipline and habit changing that they do. So sometimes I'm just able to slip them that information. I actually have a 3-page document about nutrition, and there's no shaming about it. I never try and push a patient into a whole food plant-based diet from day one. Absolutely not. In fact, I think it's probably dangerous in some people to do that because we know that the gut microbiome doesn't adapt so readily to suddenly from 10 grams of fiber in your diet. If you go up to 50 or 60 grams, it will cause bloating, it will cause abdominal discomfort, it will cause flatulence. It makes people feel really quite uncomfortable at times. So I just tell them, I meet them where they are. So if they say they're willing to make a change, then I will suggest maybe changing one meal at a time. For me, as I said, the domino effect came from my changes in my diet. After that, I was sleeping like a baby the moment I hit the pillow. I was exercising till I was falling down because I was having so much energy that I had to. So for me, nutrition is probably about 70% of it. And I know that people argue a lot about, which one the biggest or the most important pillar is. And in fact, if you listen to Professor Matthew Walker from Berkeley, who's a professor of sleep medicine, and I tend to agree with a lot of what he says, is that sleep is the foundation and the other pillars are built upon that foundation. So you have to improve your sleep hygiene first. And he talks about why that is the case hugely. And I agree with everything that he says. But the lowest hanging fruit, I mean, to use a pun, because fruit is good for us, the lowest hanging fruit for me and the easiest changes to make for me were simple changes in my dietary habits. It doesn't have to be too complicated. So if you change from white rice to brown rice or red rice, or if you add a little bit of beans or lentils into your diet, if you start including, or just go off dairy, for instance, and add soy milk into your diet on an everyday basis, you can see some pretty fantastic changes. And once you start feeling that effect, or sometimes, I'll just tell my patients, well, why don't you try it for 3 weeks? And if it doesn't work for you, just go back to whatever way you were eating. And I think one of the interesting ways that I get this message across. One of my colleagues, by the way, is a South African colleague of mine. Just as you might pass by a fruit bowl, Linda, or Siobhan, and help yourself to some fruit as a snack. He used to chew on biltong, which is dried meat, as you know. And, I was lecturing to a group of colleagues and friends who practice with me. And I was talking to them about a whole food plant-based diet. And I was what they call a vegangelist. So I was quite evangelical about my vegan beliefs and, the whole food plant-based diet. And I was talking a lot about it. And this time I just suggested to my group, why don't you try it for 3 weeks? And he was struggling at that time. And I didn't know this because he didn't tell me, but he was suffering a lot with a very high cholesterol level and wanted to bring it down. So he said he'd give it a try, and he was determined to give it a try and then meet me 3 weeks later and say to me that that was rubbish, what you told me. I've gone back to eating meat because it didn't work for me. He met me 6 weeks later and he said, this thing about this whole food plant-based thingy that you talked to me about? I said, yeah, what's that? So he said, I've lost a few kilograms and I'm feeling so good that I'm going to continue it for another year. Now, 3 years later, he's still on it and really, really happy. So it needs a spark to change people's habits, I think. And
I think you're completely right. And that catalyst, it's really interesting that you mentioned that, because that was exactly the same for me and my family. It wasn't forks over knives. It was What the Health. And myself and my sister watched it, and then we encouraged my mum too, who is diabetic. And we did exactly what you said, just said, try it for a month. And then a month turns into 3 months, and 3 months turns into 6 months. And I think you probably agree, once you realize that the huge benefits you get in every aspect of your lifestyle, you'll never be able to get it from anything else. There isn't a pill that can help you in so many different ways. And I just wanted to ask, in your experience with doing that with orthopedic patients, because I don't think many people would link, back pain to plant-based health. Have you seen a lot of success stories? Have you seen a lot of improvements?
Yeah, I mean, just to narrate a few examples. And again, I hate to give you the impression that I just don't believe in Western medicine or what I do. I am a surgeon. I love my job. I love to operate. That doesn't mean it's necessarily the right solution for everybody. I mean, spinal surgery does carry its risks. It's particularly hard, I think, if you are operating on somebody who's extremely overweight. I mean, sometimes you are operating at a great depth. I mean, the spine is a good few inches down from the back. So you're burrowing into this, through fat and then through a lot of muscle, and then you're in the depth of a deep, dark hole and operating around the spinal cord. It's stressful for me if I'm operating on somebody very heavy. And we know that weight has a big effect on the back. It's ultimately that load that you're putting through your discs, you're putting through your spinal column at all times that causes degenerative changes and affects the back. And it often results in sciatica and extremely painful things. So what do I do if I'm faced with somebody who comes to me with sciatica, which is raging? He's in agony. I mean, it's one of the most miserable pains known to mankind. And I've had women, fortunately, I've not had children myself, but people who've had children say it's worse than childbirth. And please take this pain away. And if I'm going to talk to them about a whole food plant-based diet, they're going to kill me. So, it's not appropriate at that stage. So, but it's a bit like, when you've got a forest fire going on, you don't start planting new trees in the middle of the forest fire. You have to put out the forest fire. So I will get rid of the sciatica, and I can often do an injection, or sometimes I'll do that higher risk surgery because I know there's no way out and I can't really get them to shed weight at that stage. But I think it's an involved conversation. And if you really care for your patient, I believe that you should look at the root cause of their problem, which is often the weight, often their lifestyle. It's unusual to get somebody who's done everything right, ticked all the boxes in their lifestyle, who still then has a slipped disc or a problem that's causing them pain. So I will treat them for their condition, but will tell them, please meet me halfway. After I do this for you, would you please lose weight by this method? And I give them the tools. I think one of the things I regret most in my own journey was I never had the tools. I didn't know about it. And I'm a doctor, I'm a surgeon. But I had no knowledge that this whole area of lifestyle medicine, of dietary changes existed at all till, except in the last 6 years now. So I can offer them that help. And ultimately, it's down to the patient. If they're relieved of their sciatica and they decide to continue on that trajectory towards the precipice, there's little I can do to stop it. But I think patients understand, and we underestimate their ability to understand. A lot of my colleagues used to say, oh, I don't bother talking to them about lifestyle. I mean, who's going to accept your silly whole food plant-based diet? And yes, there are some people who will turn you down, say, I'm very happy with what I eat. I'm very happy. I just cannot make changes. And you will encounter that group of patients. But on the other hand, patients do accept from a doctor very often what we tell them. And we have that position in society still where our word is taken very seriously. So I think we are being dishonest with our patients if we tell them diet doesn't make a difference, lifestyle doesn't make a difference, carry on, just take this tablet and it'll get rid of your back pain, or just have this operation and you're fine after that. I'll fuse your back for 3 segments and you should be fine after that.
Yeah, as you said, Dr. Bajekal, it's our responsibility to share this information with our patients, and it's not our job to decide what route they're going to take. Just as it is when we prescribe them a medication, we don't double guess. We prescribe it, give it to them because that's the right thing to do. And we don't make that prescription decision based on if will they take it or not. And it's so important to highlight that if we do not talk about it, we are disempowering our patients, removing the opportunity to give them a tool that is very cheap, economically sustainable, and actually really very tasty. And it could turn their life around for good. And we have noticed in research that not only their lives change, but also their families' lives. It's just incredible. Often we talk about genetics are not our destiny. And I love this example where patients would say, yes, but it's in my family, I'm going to have it. And I love to ask them, what else is in your family? And it's the kitchen. The kitchen is always the same in every family. Thus, the diseases are the same in families as well. And when we highlight this to our patients, they do step back for a minute and they do think about it, don't they?
Absolutely, absolutely. And yeah, very, very well said. I mean, it is the food habits that run in families. It's not just the genetic things, you know. So as Dean Shezai, who you, I'm sure, know, neuroscientist and neurologist from California, one of our favorite doctors again, he says, 3% of most disorders are linked to genetics, and we give it far more credibility than we should. So blaming everything on your genetic lottery is, I think, extremely unfair to your parents or your grandparents or whoever, So I think we have the chance of making a big difference in our health. I mean, Siobhan, you asked about a patient, so there was one patient who I still treat as a case in point, who was very overweight, who was insulin dependent type 2 diabetic. So she was not type 1 diabetic, but she was now using insulin for her type 2 diabetes, who was very overweight and had what we call a spondylolisthesis. So there was slippage of one vertebra or another, and it was trapping her nerves in her back. And she was getting a lot of leg pain. And my colleagues had seen her and we had discussed her in our MDT meeting. And one of them had suggested that she required a spinal fusion, which would require 4 screws, a decompression of the spine, all in all, about a 3-4 hour operation with a fairly high risk of complications. You don't put screws into people's backs without expecting that something could go wrong. And it often does, especially if the patient is overweight and diabetic. You're already fighting a losing battle there. So, and she was in a lot of pain. So I gave her some injections, which did help her. And so it put out the forest fire, like I was saying. And then I was able to engage in a more meaningful conversation. And I said, and she was adamant. She said, my diabetes is excellent. So I said, well, you're taking insulin for it. Yes, but it's very well controlled. So people know a little bit. So they think the HbA1c is all that matters. So I said, well, if you're on insulin, yes, it will be controlled, but that doesn't mean that you're doing well from this condition. What I would like to see is you changing your insulin to a lower order drug to control your diabetes, and even getting off those drugs. So I offered her some nutritional advice and some exercise advice. And because she was now free of pain, she was keener to walk and get rid of some of that weight through the nutritional advice of getting onto a whole food plant-based diet. And I said, look, we'll visit the situation about your surgery and this spinal fusion subsequently at about a 6-month stage. So come back and see me. So she came back beaming with her husband. The husband looked a bit annoyed because he was not happy with this plant-based way of eating. He was fond of his meat, I think. But he did acknowledge that both of them felt a whole lot better. She had lost a lot of weight. She'd gone from insulin onto metformin, so she'd reduced that. And she did need an operation, but she didn't require the spinal fusion. So she didn't require the screws in her back. She just required a decompression to help her. So it was a much lesser operation with a lower risk. And she's been delighted ever since. And she still comes and smiles and tells me every year or two about how her journey's been. The husband initially was really put off because he had to eat all the meat in the deep freezer for quite a while without his wife eating any of it. So he put on weight originally, but he also took to that diet and has lost weight and done really quite well. So it does make a difference, and we should treat our patients, with a modicum of respect, I think, and the fact that they are able to discern truth from fallacies. I mean, a lot of doctors, well, me included, really, because my source of information was the Daily Mail or whatever headline came onto a newspaper. Eggs are good for you one day, or the next day, salmon is good for you, or butter is back, as you know. The Time magazine had this cover. I still pull my younger daughter's leg about that because she's now an international editor for Time magazine. So I said, how dare you put that on your cover in 2015? This was well before she started actually with them. So, but I mean, there's
How
a lot.
inspiring.
Yeah.
It's so inspiring that both you and your incredible wife, Dr. Neetu Bajekal, if our guests haven't met her yet, we have a YouTube video with her. Both of you are surgeons. She's an OBGY obstetrician who told the story where she actually operated on a young lady who has been diabetic for 22 years, and she did a gynecological operation on her. And just as a side note, she discussed lifestyle changes with her. And this lady was diabetic, type 2 diabetic for 22 years, since a young age of 17 or 19, if I remember correctly. And after your wife's just side discussion after the operation, her endocrinologist, after 22 years, had to take her off of diabetic medications. Here both of you are doing an incredible job from a surgical specialty, and nobody can question your results because the feeling, the energy is palpable, the results are obvious and clear now to everyone. And I wish that all of our surgeons, colleagues in every specialty rediscover this incredible feeling of actually treating our patients and seeing them get better rather than get worse. Isn't it so such a positive feeling for doctors?
Yeah, I think, you know what I mean? I've been practicing, as you know, for 35 years. I've been doing orthopedics, and really, you do make a difference as a doctor, whatever you do, but I think I've become much more complete as a doctor since I've taken to lifestyle medicine. I just feel inadequate in just being a specialist in this narrow monocular vision area of just dealing with what's in front of me, namely a disc problem or a back problem or a neck problem or whatever it is. I just think you have to see the patient as a whole. I don't know who it was who said that a good doctor is somebody who treats the disease, and a great doctor is somebody who treats the patient. So I think it's just fantastic to be able to relieve these chronic disorders, which people think have no solutions. It's commonly understood by people that once you have high blood pressure, you're on a tablet forever. Once you have high cholesterol, you're on a statin forever. Once you're diabetic, you're on tablets and perhaps insulin at a later stage forever. That's not the case at all.
Definitely. And using your testimonies and your wife's testimonies, I think if people become more aware that you can prevent major surgery by adapting your lifestyle, then what else can you do? That's unheard of. I think that's probably a good Times article for your daughter to write, maybe. Good headline there for the front page.
Definitely. And Dr. Bajekal, before we move on to the informal group consultation part of Afternoon Tea, for those who have joined us on Zoom, would you inspire our guests with 3 actionable and practical takeaways that they can implement right away to take control of their overall health from your own journey and experience?
Okay. Yeah, absolutely. I think the first thing I would say, and it's another favorite doctor of mine, Dr. David Katz, who talks about fingers, forks, and feet. And I would use the same analogy. So if we talk about fingers first, it's habits that we have that we can do without. So if somebody, I mean, smoking is no longer, thankfully, fashionable. You know, it used to be fashionable before. Doctors used to smoke, and you know, it was not unusual to see ads with doctors smoking in it. And unfortunately, as you all know, doctors ignored 7,000 studies that smoking was injurious to health before the Surgeon General actually came out with the stamp about smoking. But another thing that is there, which even I'm guilty of, because I still enjoy my one glass of wine over a weekend sometimes. But you know, by the way, one of the side effects of eating a whole food plant-based diet is if you have more than a glass of wine, you fall asleep. Or you have a horrible hangover the next day. So I do still like my odd glass of wine on the weekends when I'm with company, because it just helps me. But I think alcohol, unfortunately, seems to have been adopted by our society as a perfectly normal thing to do. And with numbers given to everybody, like 14 units or 21 units is enough. I think we need to look at it more carefully. So the first thing is fingers. What we do is our habits. So smoking and drinking, I would cut down on radically. The second is a whole food, plant-based nutrition. So how do we do that? Well, really eating as close to the ground. And the simplest way of putting it is, if your grandmother didn't recognize it as food, it isn't food. So if it carries a nutritional label, that means that it has some element of processing that has happened in it. So it's best to pick up from the produce section. So vegetables, if you notice, don't have, this has 3 grams of protein and 10 grams of fat or whatever. So if you eat food that you have to cook and it doesn't have a nutritional label on it, that's almost certainly a whole food, whole food content. So a whole food plant-based diet is what I would recommend to everybody. And as I said, you can make incremental changes. You don't have to go a whole food, wholly whole food plant-based diet. You can head towards ideal. So aim for as much of a whole food plant-based diet as you can. And these changes you can make with one meal at a time if you wish, till you achieve your goals for good health. And the third thing I would say is exercise. Now, exercise is nebulous, but I would say if you can do at least 150 minutes of moderate intensity exercise every week, which means doing 150 minutes where you can, even walking briskly is a wholly acceptable exercise. But I would add that twice a week, everybody, and particularly because I'm keen on bone health, and you all know I have an interest in osteoporosis, and even with the plant-based diet, you can get very good quality bones. So I would say resistance training, where you do some weight training, whether it be body weight exercises, so calisthenics, or lift a weight or do it sensibly, do some weight training. That's my third habit. So to go back again, give up the bad habits such as smoking and consuming excessive alcohol. And any amount of alcohol, I think, is bad for you. Much as we have this positive confirmation bias about whatever, we like to hear good things about our bad habits, but drinking is really not good for us. The second thing is a whole food plant-based diet, or heading as close to that as possible. And the third is exercise, particularly resistance exercises.
Wonderful 3 points. our lovely guest and everybody who is watching us, you can connect with Dr. Bajekal on his wonderful Instagram, where you can search for him as Dr. Rajiv Bajekal, and he is going to have a brand new website with his name, www.rajivbajekal.com, where I believe you will be discussing lifestyle medicine and a holistic approach to patient care. And you can also join him on Facebook, again, by searching for his full name. Thank you so much, Dr. Bajekal, for joining us. Very shortly, we will go off to our non-recorded session where all of you who is on Zoom going to be able to speak to him directly. If you're joining us tomorrow, you are in a wonderful opportunity to speak to Dr. Rob Lawson, who is the co-founder of the British Society of Lifestyle Medicine in the UK. You can join us to learn how the wider determinants of health affect our disease progression. You can book your tickets through our website, and as always, our events are always for free. Our May events are dedicated to raise donations to help India breathe. If you enjoyed this session, please consider donating in the link that we have posted in the chat. And if you're on YouTube, in the comments. We are supporting two incredible charities on the ground who are helping people with oxygen and also with food. We're just going to post our links also in the chat with our website, and you can say hi to us on Instagram and on Facebook at Afternoon Tea with Docs. So lovely having you today. Thank you so much for another amazing session with you all. And now we are going off to our private kind of chit chat where we can talk to Dr. Bajekal in person. Thank you so much for watching.